And we definitely, part of our teams will be there with you. Thank you very much.
I launched the kit for the soccer marathon, running for soccer mothers, takes place on 31st August in the city. I invite all for goodwill to come and join us and support the mothers and children.
Hello everyone, I'm called Masika Masi, a youth advocate, also an intern nurse from Kawempe and Shirudu National Referral. I'm here to add my voice to encourage all the medical interns out there, the young youth leaders, the different organizations to come and partner with us in this cause. It's very important for each of us to come, add something small or big, whatever they can, to help us make this campaign a successful one. We are going to be in Jinja City on the 31st August 2024 at the end of this month. It will be a Friday. The run will start at 7 a.m. at Kikindu Stadium. So I'm encouraging everyone to come and join us. We are selling the kits at 25,000 shillings, 35,000 shillings, and 50,000 shillings. In Kampala, we shall pick the kits from Mulago Guest House. You can come and join in with different efforts, whether in technical services, whether in support services, either buying the kits, being there physically. We invite all efforts. Together you can make Uganda a better country, and together you can make Busoga a better region. Thank you so much.
Oscar Mervin, and the chairperson of the Busoga Maternal and Child Health Run. Tubadde wano okulaunchinga marathon kit oba ekyambalo kye tugenda okukolesa okudduka on 31st of August Jinja City. Tubadde wano ne First Deputy Prime Minister Honorable Alitwala Beka Kadaga agenda kubeera omugenyi omukulu okola olunaku. Tusaba nti mwenna abava mu bitongole abava mu bitongole ebitali bimu n'ebimu mujje tukole wamu nga tuyambako okuddukira ku campaign y'okukendeeza ekisooka abaana abafuna embuto nga tebannakwetuuka, ate n'okuteekako omulanga ogw'okukendeeza abakazi abafa nga bazaala mu kitundu kyaffe ekyebusoga ekisingayo okubeera n'ebyo bintu nga ku high statistic ranges. Tubasaba mubeereyoko 31st of August Jinja City Kakindu Stadium, tutandika ssaawa emu. Tulinamu ebyambalo ebyo mu mitendero. Ekisooka kya emitwalo 2.5, 3.5 n'emitwalo 5. Bili mu Jinja tubifuna ku Jinja Regional Referral Hospital ne ku Busoga Health Forum offices. Mu Kampala tubijja ku Mulago Guest House. Mwebale nnyo, tujja basangayo 31st.
Tanhuri is my name, and I've just completed my medical internship from Murago and the Kawempe National Referral Hospital. Yeah, maternal health initiatives like this are very important to the welfare and well-being of our people in our communities. One night I remember when I was in Kawempe at that labor suit, we received a mother right away from Namutumba. I had been managed from Jinja, and then the condition was and been brought to Kawempe, and surprisingly, they had come for blood. So initiatives of this kind, when I see a community getting engaged, I get zealous to join in. Well, as part of the Federation of Uganda Medical Interns, this is our calling, and would love each one of you, the communities, those who are watching us, to come and be part. Those of you who might not know what this means, of the 176 maternal mortality rate, it just means that when you have 100,000 mothers giving birth, 176 are dying because of this process. And what that means is that 17 or literally 18 of now the 100 of the 10,000 die when giving birth. And that also means that 2 of the 100 are dying while giving birth. and which means literally 1 of the 10 is dying because of giving birth. So you see the number is big. So if you bring 10 mothers here, 1 is going to die while giving birth. And this is something we don't like. It can be your daughter, it can be your mother, it can be your wife. So it is not good. Let's come up by kits that are available in Kampala, in Jinja. Let's come and contribute the monies. Let's spread awareness. Let's have these kits known. Let's have this process known. Let's contribute. You might not be able to run, but you can buy a kit. You can buy kits for others. You can buy kits for students and they run. So what we need to raise is the money that we can give to save the mothers. Money is also going to do other things. We can buy items in hospitals and support the mothers, because it's not about the running. We need blood. You can come and donate. We need oxygen for mothers who have lost blood. Part of the resuscitation process or process of bringing them back to life is we need oxygen. So we need those cylinders, and it's all about money. So come be part of us. Personally, I will be there, and as the we need mental point center, we shall be there, and as a federation, we shall be there, and as doctors of Uganda, we shall be there. See you 31st August.
We definitely, part of our teams will be there with you. Thank you very much.
My name is Bill Adrati. I'm the president for Federation of Uganda Medical Interns. The federation that brings together all the medical doctors, pharmacists, nurses, midwives, and dental surgeons in Uganda to undergo the mandatory 12 months period of training. As a federation, the country mainly knows the medical interns for the manner of engagement, especially along fronts of deployment, issues on payment, and then also the contribution they make towards health service delivery during the mandatory 12 months period. But however, we believe that this is a huge human resource that can make a much more big and significant contribution towards health service delivery. We sat down and came up with the program of Maternal and Child Health Marathon, which is aimed at improving the indicators of maternal and child health in the Busoga sub-region by supplementing the government efforts. Along that front, today we are here at the office of the Prime Minister, the first Deputy Prime Minister, Right Honorable Rebecca Kadaga, who is going to be our chief guest for this event. And today, she was able to launch officially the marathon to the public. We are calling upon more partners to join us on top of the Ministry of Health, the Busoga Kingdom, the Busoga Consortium for Development, the Busoga Health Forum, the different companies and organizations joining us. We call upon all Ugandans of goodwill, the people in the different, in the political, religious, and social spaces. We call them to join us so that we can improve maternal and child health service delivery in Busoga sub-region. Thank you.
I'm called Dr. Oscar Melvin, and I'm the chair for Busoga Maternal and Child Health Run 2024 edition. We are so much glad to launch the kit today with our chief guest and the chief runner, the first Deputy Prime Minister, Honorable Rebecca Kadaga. And on the same voice, we have joined their hands to join their voices, and as we run this campaign on awareness on maternal and child health, specifically targeting teenage pregnancy as one of the indicators. We are having the event on 31st of August in Jinja City, and at Kakindu Stadium. We are starting at 7 a.m. sharp, and we call everyone to come and join in, both in cash, in kind, and in technical support. Buy the kits. We welcome all the contributions as we join this cause. Our kits, 25,000, 35,000, and 50,000. And we have the collection point or the pickup points. In Kampala, we are at Mulago Guest House. In Jinja, we're at Jinja Regional Referral Hospital. And at Busoga Health Forum head offices. In Iganga, we're having at Iganga Regional Referral Hospital, and other aspects in Namayingo, in Namutumba, Buyikwe, Bujili, and all Luka, and all other 11 districts in Busoga sub-region. We call upon everyone as we join us as we do this first edition. Thank you so much. See you there on 31st of August at Kakindu Stadium City. Thank you.
The other thing we are doing to deal with poverty We have under the consortium the village agriculture model, which we borrowed from China. We have, in the last 1 month, we have identified three villages where we're going to grow specifically for the market of China, cassava, simsim, beans, and soya, which we already have a market in one of the provinces in China. We have got a memorandum of understanding. So we think that with time, if we can succeed in those three pilot areas, we shall translate it to the other villages and identify crops that are good in that area. For instance, if we look at Namutumba, we'll probably say concentrate on the groundnuts. That's what you grow best. Then look at the areas that produce soya so that we can use that as a springboard. So these are the efforts which are going on. But otherwise, you are welcome. We shall see you. The run will be in Jinja Town?
Yes, so
Jinja City. Okay. What time?
starting at exactly 7
Mm.
a.m.
Mm.
Once done.
Yeah, I have a number of things on that day, but I'll come for the maternal run. So thank you so much. I need to go for a meeting of the women lawyers. They're also waiting for me. But I'll launch the kit.
I want to request.
Hereby launch the kit for the Busoga Marathon, running for Busoga mothers. Take place on 31st August in the city. I invite all for goodwill to come and join us and support the mothers and children. It's for the water. Okay, and this is what you use for the water as you run. Dehydration could kill it. President Joy. President Joy is okay. Are we all there? Yeah. So that he will run. Oh, Kingdom Heaven. Yeah.
Consortium.
Consortium.
Okay, the interns.
They can't bring more than
That's what they succeeded in changing my interest.
Dr. Mwanga Moses are my names. I'm an assistant commissioner at the Department of Clinical Service. I'm here when we are launching the maternal and child health run for Busoga Kingdom. Basically, as Minister of Health, we're excited when we see people coming together to join us really curb down the maternal deaths in Busoga. As a country, our maternal deaths is 179 per 100,000 births, but in Busoga it's 448, which is 3 times as much as what we see on national level. Then the child deaths, nationally we are looking at 27 per 100 births, but in Busoga it's 58, implying that in Busoga region, really there is a lot which is needed. So when we see the real people concerned get in touch to ensure that the maternal deaths as well as the child deaths is brought down, we become excited and we become part and parcel. So this marathon, basically, we are in it to ensure that awareness is done, especially on teenage pregnancy, education of the girl child, as well as use of contraceptives. So we are calling all the people around there, especially the kingdom. We want the chiefs to pass on this information to the people down there, that they really need to save their women, their children, because we are losing many of them in this struggle of maternal death. So as Minister of Health, we are in line with it, and we call upon everyone to join them on the 31st this month.
Why has Busoga become a very hard nut to crack?
That's why we are bringing on board the real inmate, because at national level, just as I told you,
our maternal death is 179. It would have been even much lower if there was